and Medical Services, the Honorable Dr. Atonio Lalabalavu.
Thank you, Mr. Speaker, sir. Honorable Speaker, sir, the Honorable Prime Minister, Honorable Leader of Opposition, Honorable Deputy Prime Ministers, Honorable Members of Parliament, distinguished guests, ladies and gentlemen. I rise to respond to His Excellency the President, Atonio Lalabalavu's most gracious address for the opening of the 2025 session of Parliament. In his address on Monday, 24th February 2025, His Excellency the President clearly outlined the plan of actions that the government should undertake in the next 12 months based on the wishes and interests of the people of Fiji. His Excellency the President laid down a clear challenge for all members on both sides of this august house to rise above the challenges of politics and internal differences, to work together and work collectively with the people we represent for the betterment and prosperity of our people and the country as a whole. Honorable Speaker, sir, His Excellency, the President highlighted the review of a number of legislations under the Ministry of Health and Medical Services ambit to update old legislation as well as enhance existing ones to address the current needs and new challenges faced in the implementation of these legislations. The Ministry has initiated and progressed the review processes for a number of critical health legislations, and I wish to provide a brief update on the progress. The Burial and Cremations Act of 1911 is among the oldest legislation under the Ministry. A technical team by the Ministry of Health such as the Solicitor General's Office and the Fiji Correction Services on this 114-year-old Act, and the review process is anticipated to be completed in April of 2025. The review process on the 61-year-old Quarantine Act of 1964 is underway following Cabinet's endorsement. The review process will involve important stakeholders such as Ministry of Tourism and Civil Aviation, the Ministry of Youth Affairs, and it is anticipated to be completed by June of 2025. On the Radiation Health Act of 2009, a multi-stakeholder, multi-sectorial technical working group constituted in 2024, with the support of Solicitor General's Office, have completed internal and public consultations for the review of the Act. Further consultations with the International Atomic Energy Agency, or IAEA, will take place in March towards finalizing the outcome of the review. The World Health Organization has expressed its support for the ministries towards the review of the Mental Health Act of 2010. Internal discussions of the review process has started, and the WHO will engage an external consultant with expertise in global mental legislation review to work alongside the Ministry and the Office of the Solicitor General on the review process. This work is anticipated to be completed this year. Fiji Nursing Council is tasked with leading and coordinating the review of the Nursing Act of 2011. Consultation with the Solicitor General's Office has been undertaken, and the multi-stakeholder and public consultation are planned for the coming months, while the review process is expected to be completed by December of 2025. Honorable Speaker, sir, in his remark, His Excellency the President advocated for an overhaul in the health and medical care delivery system in Fiji. The recently published Health Sector Review report of 2024 from the World Bank clearly showed that while Fiji has graduated from a low middle-income country to a high middle-income country, our health status indicators has remained stagnant and has not improved in the last decade. In fact, our health status indicators of the last decades are the same or even lower than comparative low middle-income countries. The report has a relevant theme titled Lalabalavu, or wishing you healthy life and long life. This theme aligns well to the call of vision of His Excellency the President. In response, the Ministry is focused on realigning its functions to service for a greater focus on primary health care, and believes primary health care is the means to address the current pressing public health issues of non-communicable disease and endemic infectious disease in our population. The Ministry is finalizing its primary health care strategy that will guide the transformation of primary health care services at all levels in the Ministry and in the years to come. Transformation is necessary to ensure we are tackling health problems early through health prevention and promotion strategies, with early referrals before they become severe and complicated and more difficult to address. In addition, the Ministry is working with the Ministry of Finance and Strategic Planning, National Development and Statistics, and the World Bank, as well as our partners such as ADB, DFAT, MFAT, JICA and COICA, and bilateral partners to undertake a significant overhaul of health facilities that support and facilitate a transformed primary health care services for our people. This initiative will involve modernizing and equipping our primary health care facilities at nursing stations, health centers, and subdivisional hospitals to better deliver health services, while at the same time better promote health for the population. In addition, as highlighted by His Excellency the President, the Ministry is working with our partners for the upgrading of tertiary health services in the next 5 to 10 years through establishment of the 100 beds regionally super specialty cardiovascular hospital by the Government of India, the new National Rehabilitation Hospital funded by COICA for more than $20 million, the CWM Hospital Development Project funded by DFAT and the Australian Government, and the untiring work of individuals and organizations such as Dr. Vijay Kapadia and his dedicated team of specialist overseas cardiologists, Dr. Russell Metcalf, Dr. Neil Price, and their dedicated team of pediatric surgeons, and Dr. O, Dr. Murali, Dr. Suren Krishna, and their dedicated team of specialist overseas team of ENT surgeons, to name a few, who pay their own way into Fiji and provide free, high-level medical care and mentoring and training for our local health teams. In talking about human resource, Honorable Speaker, sir, right-sizing our human resource for health is an important strategy in transforming our primary health care approach, and it continues to be a major priority for government. The exodus of well-trained and competent healthcare workers from the Ministry continue to pose many challenges in our effort to deliver quality health services for our people. In the fiscal year of 2022 to 2023, the Ministry recorded an alarming and unusual number of resignations, with 221 doctors, 982 nurses leaving our ranks. However, since 2023, the Ministry has witnessed a promising trend of decline in these figures. In the 2023-2024 fiscal year, the number of resigning doctors decreased to 48, while the number of nurses fell to 241. As of the current year, 2024 to 2025, to date, we've seen further reductions, 39 doctors and 65 nurses resigning thus far. This positive shift largely can be attributed to the workforce interventions that government has introduced since 2023 that included raising the retirement age from 55 to 60, the wage increase for civil servants, and specific measures for new retention allowances and salary increments for our nursing staff. Moreover, we have seen noteworthy increases in healthcare workers, particularly nurses, who are nurses rejoining the Ministry, a hopeful and signaling a reversal in workforce mobility trends. The Ministry has also proceeded to address retention challenges with the pharmaceutical cadre, following successful completion of the internship program and passing the registration exams. Newly qualified pharmacists often find better financial incentives in the retail sector. To counter this, the Ministry has offered a more competitive salary package, elevating their pay for pharmacists to step 4 of Band G, the amount of more than 40,000 per annum, as opposed to the previous step high rate. Similarly, we recognize the necessity of attracting and retaining medical imaging technologies, and we are implementing a comparable approach by offering recruitment at step 4 Band F with a salary of more than 30,000 per annum once they enter into employment at the Ministry. In addition, we have progressed with establishing the Ministry's strategic workforce plan of 2025-2024. Consultations and stakeholders such as the Ministry of Civil Service, FNU, University of Fiji, the Tertiary Loans and Scholarship Board, private health sector, DFED, WHO, Fiji Medical and Dental Council, and the Fiji Nursing Council, and department heads within the ministry have undertaken, and the plan is expected to be ready by the end of the current fiscal year. The ministry values its workforce highly and continues to make a positive headway in addressing its workforce need. Honorable Speaker, sir, to talk on the HIV outbreak in Fiji, the declaration of the HIV outbreak in Fiji by the Ministry of Health and Medical Services on January 22nd, 2025 highlights the need for the government and the country to tackle the disease head-on. The HIV outbreak presents an unprecedented health challenge that will require resources, expertise, and partnership across all sectors and the community to control. The role of illicit drugs, and in particular injectable drug use, is directly impacting the sharp increase in new cases of HIV in Fiji. The ministry is committed to ensuring a rapid, coordinated, and evidence-driven response, working in close collaboration with national, international partners to mitigate and impact HIV in our communities. The ministry has launched the Outbreak Response Plan and the National HIV Strategy 2024 to 2027, with strategies that are in line with the ministry's role under the Counter-Narcotic Strategy 2023 and 2028. The HIV Board, under the HIV/AIDS Act of 2011, has since established the National HIV Outbreak and Cluster Response Task Force, which is tasked to lead, coordinate, and cross-sector outbreak response. The role of the task force includes coordination, strengthening the system for diagnostics and prevention and treatment and care, and ensuring supportive environment for key populations and affected communities. Reorienting the program response for Ministry of Health and Medical Services to effectively tackle the emerging HIV pandemic through evidence-based interventions and mobilizing technical and financial support for sustained HIV response efforts. The Outbreak Response Plan focuses prioritize high-impact, evidence-based interventions to effectively contain the outbreak and align our program response towards HIV, STIs, and bloodborne viruses with a projected estimated budget of more than 8 million for full implementation. The ministry will work with government, our partners, and community in implementing strategies. It is important that our combined response must not be politicized for the purpose of point scoring, but it is a collective effort to break down the barriers of stigma and discrimination and promote actions that will halt the spread of HIV in our communities. On non-communicable disease, Honorable Speaker, sir, the Ministry of Health and Medical Services forges on with its war to address the burden of NCDs in our communities, and I will continue to speak and repeat the messages in NCD at every opportunity I get, because it is the one public health concern that requires a total paradigm shift in the way we live now and how we raise our children for the future. The Republic of Fiji Vital Statistic Reports of 2016 to 2021 show that NCDs accounted for 80% of all deaths in our country. It is crucial to recognize the profound impact of this disease we have on our health systems and society. Hospital admissions to complications from NCDs such as heart attacks, strokes, diabetes-related ailments impose an overwhelming burden on our healthcare facilities and resources. In 2019, healthcare costs associated with NCDs escalated to 591 million Fiji dollars, underscoring urgent need for preventative measures. Fiji 2021 multiple indicator cluster survey finding reveal alarming dietary patterns, with children and adults consuming low levels of nutritious foods while favoring sugary beverages. Understanding that 95% of NCDs are linked to lifestyle choices, we must tackle the well-known four main modifiable risk factors in tobacco use, physical activity, unhealthy diets, and excessive alcohol consumptions through assertive and sustained actions at all levels in legislations, governance, community, family, and personal actions and initiatives. Recent government actions in increasing tax on cigarettes and sugar and sweetened beverages, endorsement and implementation of the National Policy of Health, catering in government institutions, and the endorsement of early childhood development policy for Fiji and the school health policy will begin to foster the healthy environment that our children and our future generations will grow in. The Ministry is progressing its work on the STEP survey with the assistance of the Fiji Bureau of Statistics and our partners, and should be completed in this financial year. Mr. Speaker, speaking on governance and community engagement, the Ministry remains committed to embarking on a transformative journey for our healthcare system. This year, we will initiate the formulation of the new 5-year National Health Strategic Plan for the 2026 to 2030 period. This plan will supersede the current health strategic plan, which has guided us from 2020 to 2025. The new strategic plan will be aligned to the National Development Plan and vision. It will incorporate valuable insights and recommendations from the recent health sector review of 2024. Furthermore, the Ministry shortly commence on its evaluation of the Ministry's strategic and operational actions for the last 15 years. This evaluation is vital as it will lay the groundwork for the National Health Summit that we aim to convene before June of 2025. To strengthen our commitments further, we will enhance our monitoring and evaluation and learning activities within the Ministry. This initiative will ensure that our delivery services improve and that our decision-making processes are firmly rooted in data-driven insights. The Ministry has also implemented measures to ensure better utilization of resources allocated by government under the Ministry's budgetary allocation in each financial year. Monthly budget meetings, regular site visitations to health facilities, and internal environment of budgetary allocations are measures that the Ministry is undertaking to ensure better utilizations of resources at its disposal. To strengthen community partnership in the delivery of our health services, the Ministry has embarked on strengthening the role of Board of Vistas for our hospitals and health facilities. Through the work of Board of Vistas, supporting leadership teams for the health facilities, BOV partnerships with the community allows for improvement to infrastructure and service delivery by the health facilities. Examples of such BOV partnerships with the community and the business sector include renovation work completed at CW Hospital by the ANZ Bank in 2024. Renovation at Singatok Hospital in 2024 by Intercontinental Hotel. Renovation of the Counselling Centre in Nandi by Empower Pacific. And LDS Church, the value of 90,000 Fiji dollar. Renovation of SOPD at Nandi Hospital by Jax of Fiji Limited. Renovation of the women's ward restrooms for 40,000 Fiji dollar by Radisson Hotel in Nandi late last year, and the upcoming renovations of men's ward at Nandi Hospital by Wyndham Hotel in Nandi. These are only a few examples of successful partnerships between BOV and the community that has supported the provisions of health services in our health facilities, and thus effort will continue into the future. In conclusion, Mr. Speaker, sir, last Friday, for the first time ever, the Ministry's National Health Executive Committee meeting took place in a community setting, rebuilding and strengthening all bridges in partnership between community members and the Ministry. The meeting, which included senior executives, senior divisional heads, heads of departments, institutions, clinical services network, was a very successful and productive forum. 6 new health policies for the ministries were endorsed in those meetings, and more on the way. And I wish to conclude by acknowledging and thanking the people of Navidovatu village, in the district of Wenimbuka, and the Vunu of Naloto, Wanawanturang and Wunival, the Twinaloto, for their warm welcome and gracious hospitality to the executives of the ministry. The simple message from the meeting is that health work is not solely the ministry's responsibility. It is a partnership between ministry, the government, the health service provider, and the people. The ministry looks forward to working with our community and our partners in improving health status on our people, to all our people here in Fiji. A lot has been done by the Ministry of Health and Medical Services on improving healthcare service in Fiji, and a lot will continue to be done today and into the future. Fully support and endorse the motion before the House, and I thank you, Honourable Speakers.